Did you know that lithium is a mineral as old as the universe itself and is also a crucial element to brain health? And beyond its well-known prescription form lithium carbonate or lithium citrate, which I mentioned in my previous video, if you missed that, go ahead and check it out. But beyond that, lithium orotate, which is a supplement found over the counter, can actually have very beneficial effects on your mental health. And in today's video, that's what we're going to explore. So stay tuned. So lithium is more than a drug. Lithium is often purely seen as a psychiatric medication. However, it has a rich history beyond that. It's both a natural element and a scientific enigma. You see, lithium is found in the earth, in the soil, but also is found in our bodies. Today, lithium is extracted to make things like lithium batteries, the medication lithium, and of course, the nutritional supplement lithium orotate. But what is lithium orotate? Well, lithium orotate is taking the ion lithium and combining it with orotic acid. And when it's combined with orotic acid, it is proposed to have a better bioavailability, meaning it actually gets into the cells better and more effectively than lithium carbonate or lithium citrate. So you only require small dosages of lithium orotate to actually have an effect. Now let's talk about the history of lithium. Lithium is actually derived from the Greek word for stone and was identified in 1817 and has been used in medicine since the early 1800s. And in the 1800s, lithium was used to dissolve uric acid in kidney stones. By the 1900s, lithium was used in natural spring waters and also as a health tonic. It was also used in the 1900s, briefly added to our soft drink 7-Up as a mood enhancer. And in 1949, scientist John Cade discovered lithium's role in treating mania. And despite its life-saving benefits for treating bipolar disorder, it was actually sidelined. And now it's actually used as a gold standard treatment for treating bipolar disorder, despite its toxicity effects, because we can check serum levels. And as I mentioned in the video on prescription lithium, those serum concentration levels and margins are very small. So when prescribed prescription lithium, you have to make sure you're getting tested pretty regularly to make sure you're not going into lithium toxicity. Now, the shift to low-dose lithium, as in lithium orotate used in supplements over the counter, actually helps to reduce the potential side effects that we see with lithium carbonate or lithium citrate, while preserving the benefits of lithium in certain circumstances. So I'm not saying that we're going to be using lithium orotate to treat severe bipolar disorder or mania, but lithium orotate can actually be used to treat things like depression, or used as an adjunct for depression. Can also be used to reduce suicide and has benefit to reducing the symptoms of suicidal ideation in depressed patients and even bipolar patients. Can also be used for ADHD and kids who have what's called disruptive mood dysregulation or severe irritability or agitation. And lithium is also used or has been used to help to enhance cognitive benefits and to help people with ADHD or even those who just want to prevent aging of the brain or who have high risk for things like Alzheimer's disease or dementia, because it actually has been shown to be neuroprotective. So now let's talk about lithium's role in the brain. Well, as I just mentioned, it's said to be neuroprotective, and that is true. It's neuroprotective, but also helps with mood regulation. Lithium influences and enhances brain plasticity or neuroplasticity. It helps to reduce inflammation and also helps to balance out and modulate neurotransmitters. And it directly affects serotonin, dopamine, glutamate, and GABA to help with balancing mood. And it also inhibits GSK3, which is a protein involved in neurodegeneration and mood disorders. So inhibiting this GSK3, it is actually very neuroprotective. And so let's talk about microdosing lithium for brain health. Now, research suggests that even a trace amount of lithium found in drinking water correlates with lower suicide rates and reduced dementia risk. So this raises the question, can lithium orotate provide gentle, long-term cognitive effects and benefits? Well, the answer is yes. And so let's talk about lithium orotate versus prescription lithium and what we're talking about here with dosing. So when you look at the differences between lithium orotate and prescription lithium, elemental lithium concentration in lithium orotate is only 3.83 milligrams per 100 milligrams. Prescription lithium is 1.8 to 100 milligrams. Now, I want to say that when we're talking about using lithium orotate, we're going to be using 1 to 30 milligrams. If you're going to go beyond 30 milligrams of lithium orotate, it is recommended to just switch to lithium carbonate at 150 milligrams because you can monitor the serum concentration levels. You see, because lithium orotate goes directly into the cells, you will not get serum concentration levels from lithium orotate unless you're taking it into the thousands of milligrams. However, there have been reports of people having side effects of toxicity in higher dosages. Therefore, it's safest to say that if you're going to use lithium orotate and you feel like you need a higher dose than 30 milligrams, it's better to switch to lithium carbonate. That way you can measure your serum concentrations and make sure you do not go into lithium toxicity. The uses of lithium orotate are pretty broad, but it can support mood, as I mentioned, and also is neuroprotection. And many people who are using lithium orotate are using it for its anti-aging benefits, to prevent things like Alzheimer's, and just to help with cognitive focus and attention, and to support overall brain health. But there are people using lithium to actually treat mental health conditions and disorders like depression, bipolar 2, ADHD, and mood instability or irritability as a symptom of other mental health conditions, as I mentioned earlier. Now, with prescription lithium, we're going to be using, these higher dosages, 900 to 800 milligrams. You have to do the serum concentration monitoring to make sure you're not going toxic. But prescription lithium is going to be reserved for those with severe bipolar disorder or mania. That is where you're going to be using or wanting to use prescription lithium. Now, the side effects of lithium orotate are very minimal. You may get reports of maybe feeling a little sedated or too tired. It may have too much of a relaxing effect for some people. But overall, the side effects of lithium orotate are very minimal versus the side effects of lithium carbonate when you're using these high prescriptive doses. And I went over the plethora of symptoms and warnings and precautions and whatnot with lithium carbonate in my previous videos, so make sure to check that one out. And then, of course, when it comes to monitoring, like I mentioned, we don't monitor serum concentrations with the over-the-counter lithium orotate. It's a supplement, but it is advised if you're using their prescription lithium. And so just to emphasize, lithium orotate is not a replacement for prescription lithium. And if you're thinking about using lithium orotate, it can be used adjunctively to your treatment for bipolar. For instance, if you are at, say, 900 milligrams a day for lithium carbonate, and you're not getting the full therapeutic dose, and when you try to bump up to 1200 milligrams, you start having some significant side effects. You can try to use lithium orotate to get a in-between dose. For instance, just adding in maybe 10 or 20 milligrams of lithium orotate with that 900 milligrams could actually be therapeutic without adding to the side effect burden. So that's a way lithium orotate can be used as an adjunct to bipolar treatment and an adjunct to lithium carbonate. It can also be used as an adjunct to antidepressants for those with treatment-resistant depression, but can also be used to treat depression as a singular element. And those dosages can be anywhere from 5 to 30 milligrams, depending on how severe the symptoms are. But anytime you're going to be using lithium orotate, even though it is a supplement that is over the counter, it is advised that you do so under the direction of a provider who understands how to use nutritional lithium. And so you're probably thinking, is lithium orotate right for me? Well, the potential benefits, of course, are mood balance, it's neuroprotective, and cognitive health. So if you're someone who has a high risk for, say, Alzheimer's disease, and you have a family history of it, or you have the APOE gene, which indicates a high risk for Alzheimer's, then perhaps using low-dose lithium could be appropriate for you. It could also be very useful if you have a symptom of, say, aggression or irritability. It's been found very helpful and useful in those circumstances, and actually also helpful and useful for those who have alcohol use disorder or any type of addiction for that matter. It has been shown to be very helpful in those conditions, along with the others that I mentioned, ADHD, depression, and bipolar 2. And again, even though lithium orotate is considered safer than lithium carbonate, you should still be cautious, especially if you have kidney disease, any thyroid disorders, or are taking other medications, because there can be some drug interactions with lithium orotate. So again, always use under the direction of your provider. You should also be cautious and probably not use lithium orotate if you're pregnant or breastfeeding, because there's little data on lithium orotate in this population. And because we know prescriptive lithium can actually be teratogenic or cause birth defects and abnormalities, it's best to be on the safe side and not use lithium orotate during pregnancy. And as I mentioned earlier, those with severe psychiatric conditions or disorders should always consult with your healthcare provider first before diving into using lithium orotate, or even stopping your medications or trying to use lithium orotate as an adjunct. And so in conclusion, lithium is more than just a drug, and it has vast benefits to our mental health. Lithium orotate offers a very gentle approach, but still needs more research to fully understand its effects. And if you're going to embark on trying lithium orotate, I would advise doing so under the direction of your provider. And if you want to dive deep into lithium and the topic of lithium, I suggest getting this book, Nutritional Lithium. It's a Cinderella story by Dr. James Greenblatt. And he also has a wonderful website and information on the web on nutritional lithium that I'll make sure to link in the description if you're interested in learning more and diving deep, because this was just a high-level overview of using nutritional lithium to support your mental health. So if you had any experience with using nutritional lithium and want to share it with us, go ahead and put it down in the comment section below, because we learn from sharing each other's experiences. And if you like learning about holistic treatments for mental health, make sure to check out my playlist, Holistic Treatments for Mental Health, where I talk about things like lithium, magnesium, and nutrients that are supportive for overall mental health and brain health. And make sure to like and subscribe so you get more of this content coming your way on holistic treatments for mental health. I'm going to be diving deep into other topics such as pyroluria and B6 and other nutrients that are very important for your mental health. So as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next time.